If you have sciatica, you are not stuck with it. There are treatments which are proven to reduce the symptoms and heal sciatica. And no, this is not a video about me telling you to go get surgery. What does work? That is what we're talking about in this video. Sciatica is a common and brutal form of lower back pain. As many as 40% of people suffer from it at some point during their life. It makes up about 10% of all lower back issues. It shows up most often in a person's 30s, especially for people who don't exercise regularly. What is sciatica? In your lower back, your lumbar spine sits above your sacrum. Your sacrum is this broad bone that makes up the firm surface above your butt and between the top of your glutes. Your sciatic nerve originates from your lower lumbar spine and your upper sacrum. It runs down from your lower back, down the middle of your glutes, and through the back of your thigh. It branches out into several smaller nerves that run through your lower leg and into the top of your foot. Sciatica is any condition where the sciatic nerve is impacted or compressed. It can be caused by other back issues such as a herniated or bulging disc. Symptoms include pain starting at the lower back and shooting down your leg, pins and needles, tingling and numbness in the glute area, and muscle spasms. So how can you treat it? I'm going to focus on what you can do without a major medical intervention. Yes, surgery does work. It's best for extreme cases. And generally, surgery is great for short-term results, but some of the research on surgery shows that the benefits decrease over time. Non-opioid pain medications are also shown to work for reducing pain and improving people's quality of life while having sciatica. Epidural steroid injections do help with pain relief, but they're not a cure. The relief is just temporary. People who get the injections need to go for repeated visits to continue to suppress the pain. Let's identify what does not work. Bed rest. Bed rest as a main treatment is not shown to reduce sciatic pain intensity or other outcomes. Bed rest is usually not a good option for pain management in general. This might seem counterintuitive, right? If you have pain, you should avoid movement and avoid irritating that injured area. But bed rest can make the problem worse. Long-term rest leads to losing strength in the surrounding muscles and the joints become stiffer. As a result, you have more pain and limited movement in the painful area. Bed rest is rarely the answer for pain. Another method that does not work for sciatica is traction. Traction is a method used to relieve pain by stretching the spine. It can be done with manual effort, by leaning over a counter or the edge of a bed, or by using a pulley to apply force to relieve the pressure. Similar to bed rest, traction is not shown to improve outcomes such as pain intensity for people suffering from sciatica. Let's talk about what actually works. Acupuncture. A large number of studies show acupuncture to be effective for those with sciatica. Acupuncture works by reducing pain and symptoms. The benefits of it can actually last longer than medications, and with the acupuncture versus the medications, you're less likely to suffer side effects. It works in a few ways. It can block the delivery of pain messaging. It can also help relieve existing pain. People also develop a higher tolerance for pain when undergoing regular acupuncture treatments. A number of physical therapy exercises are also shown to improve sciatica. One of them is nerve gliding or nerve flossing. Nerve gliding or nerve flossing is a simple exercise that can be done at home. With sciatica, the nerve is impinged, and nerve gliding can help loosen the impingement. As a result, through nerve gliding, people can reduce pain, numbness, and tingling. As I mentioned, this is a simple exercise that can be performed at home in a sitting or lying position. You can find tons of videos on YouTube regarding how to perform this exercise. Something else that can work are core stabilization exercises. Personally, I'm generally a fan of strength exercises for pain management. Sciatica operates a little differently though. Strength exercises are not an effective way to improve sciatic symptoms. Core stabilization exercises are effective for reducing pain and sciatica-related disability. Specific exercises that can help are the bird dog, pelvic bridges, and the curl-up exercise. You can find examples of all these exercises by searching YouTube or doing a simple Google search. To learn more about managing other types of back pain, check out my video, Fix Lower Back Pain for Good. If you want to get weekly ideas to help you manage your health, subscribe below. I'm Dr. Preuss. Thanks for watching this video.